Our primary role when there is an outbreak of communicable diseases or even one case is to collect the data, analyze the data, and make recommendations for interventions to stop the spread of disease based on the information we have about the disease and the data we collect. The most important step once we receive a report of a COVID-19 case is contacting the person to let them know they are positive so they can isolate away from other people, not spread the disease, and so they know what to do next. Secondly, we investigate the case or interview the person, and sometimes their healthcare provider or the facility they're in, depending on the situation, and learn when they developed their symptoms, when they became infectious, and who they exposed while they were infectious. Public health uses the information they learn to provide that person with individualized guidance on how long they need to stay isolated, when they should seek care if their symptoms worsen, and generally how to keep the disease from spreading to others. All of this is done by a highly trained public health investigator. Then, once the information about who is exposed by that case is given to the investigator, that information is electronically transferred. That's the contacts information is electronically transferred to the Crisis Response Network, or AZ211, who then notifies the contacts that they have been exposed and provides specific recommendations to them based on the exposure. These are the contact tracers, and they enroll these contacts into a system that monitors their symptoms daily, and if the person develops symptoms, the system flags a public health investigator to then call that person, tell them to isolate, make sure they know what to do next and how to seek care, and then they would interview that case if that person then became a case. We do this same process, the same kind of work, only it's typically the investigator does the entire investigation and contact tracing for over 80 reportable diseases. This is something that we do all year long, all the time, and we've simply adapted our usual processes to the thousands of COVID-19 cases that we're receiving and divided it into two steps, with the contact tracing being delegated out to our partners at Crisis Response Network. All the recommendations that we make vary based on the particular situation and the disease that we're dealing with. So a foodborne disease would have very different recommendations than a disease that's transmitted by droplets like flu or COVID-19, or even one that is transmitted in tiny airborne particles like tuberculosis or measles. Our recommendations also vary by whether it's an isolated case or we have evidence of community-wide spread that requires a much larger coordinated response, like with COVID-19. For each disease and case, our goal is to provide specific guidance based on the situation and disease to make sure the person is aware of their diagnosis, does not spread it further, and that anyone else who's been exposed is aware of the exposure. And it's important that we take all the information from the literature and the information from our local area to make the best recommendations possible for our cases. A lot of people think that we actually enforce these recommendations. When we provide guidance, we are trusting the public that they will do the right thing and do what they need to do to prevent the spread of the disease. Our role is not to set regulations, and we do not enforce them except in very rare circumstances. Our role and our expertise is in analyzing data and communicating recommendations based on those data to people with infectious diseases and decision makers. I'm proud to say that we have an amazing team of experienced experts that are providing all of our public and our decision makers with data-based information every day.